Remember that the proper depiction of endometrium needs transvaginal ultrasound. It's not enough to see it by transabdominal. And when we see the endometrium, we have to know the different endometria we can find in the different phases of the endometrial phases or of the menstrual cycle. This is transvaginal ultrasound. The urinary bladder should be up to the left side and it's completely empty here. This is a triple endometrium, as you can see here, and this is the late proliferative phase or the ovulatory phase. And this is the transverse section after, of course, rotating your probe 90 degrees towards you when you are using it. And this is the 3D coronal plane of the uterus, in which you can see the endometrium here is properly normal. It's clearly normal and clear. As you can see, also the myometrium here is completely homogeneous with no focal masses and no endometrial abnormalities or congenital anomalies of the uterus. So these are the 3 scans in which you can get the longitudinal section of the uterus, and this is the endometrium in the longitudinal section, the anteroposterior diameter, and this is in the transverse section, and this is in the coronal plane. And of course the coronal plane is just seen by 3D ultrasound. In this picture, for an example, you can see a 3D coronal plane of the endometrium in which I'm getting, this is the cut plane, in which I'm using this cut plane, or this cut line, in which I'm getting or rendering the 2D picture to 3D ultrasound picture. And of course, according to the activated box, I'm activating here the A box. And so this is the 3D picture of this endometrium, and as you can see here, the myometrium is continuous, but there is an abnormality here in which you can see partially 2 upper cavities of the endometrium, and of course this is a septum, so this is a septate uterus. And of course this is completely different from the bicornuate uterus, in which you will find also there is 2 cornua of the myometrium as well, but here the myometrium is continuous in the upper border of the myometrium. And this is another picture. If you remember this picture, or to remind you of these anomalies in which we may find ionicornuate uterus, uterus diadelphys, and it can be, of course, uterus diadelphys bicollis or even bicolpus, until you find the upper 2/3 of the vagina, because as we know that they are Mullerian in origin, but the lower third of the vagina is actually arising from the cloaca, and this is in the embryological development. And here the bicornuate uterus, and this is how the septate uterus is appearing, the arcuate uterus, and how the septate uterus, or a complete or a complete septum of the uterus. These are different entities of some uterine anomalies, but actually they are not all the uterine anomalies. And I'll give you another actually lecture to try to, as much as I can, to explain all the other congenital anomalies and how to see them by ultrasound according to the American Fertility Society classification and the picture of this classification.